Institute of Pharmacy name, Sheikh Malik class, Diploma first year subject, SP, Dengue disease roll number, 56. Dengue symptoms fever with any of the following: eye pain, fever, headache, muscle pain, bone pain, nausea, vomiting, joint pain, rash. Overview: dengue. Dengue fever is a mosquito-borne illness that occurs in tropical and subtropical areas of the world. Mild dengue fever causes a high fever and flu-like symptoms. The severe form of dengue fever, also called dengue hemorrhagic fever, can cause serious bleeding, a sudden drop in blood pressure, shock, and death. The Western Pacific Islands, Latin America, and Africa. But the disease has been spreading to new areas, including local outbreaks in Europe and southern parts of the United States. Researchers are working on dengue fever vaccines. For now, in areas where dengue fever is common, the best ways to prevent infection are to avoid being bitten by mosquitoes and to take steps to reduce the mosquito population. Symptoms: many people experience no signs or symptoms of a dengue infection. When symptoms do occur, they may be mistaken for other illnesses such as the flu, and usually begin 4 to 10 days after you are bitten by an infected mosquito. Dengue fever causes a high fever 104F, 40C, and any of the following signs and symptoms: headache, muscle, bone or joint pain, nausea, vomiting, pain behind the eyes, swollen glands, rash. Most people recover within a week or so. In some cases, symptoms worsen and can become life-threatening. This is called severe dengue, dengue hemorrhagic fever, or dengue shock syndrome. Severe dengue happens when your blood vessels become damaged and leaky, and the number of clot-forming cells, platelets, in your bloodstream drops. This can lead to shock, internal bleeding, organ failure, and even death. Warning signs of severe dengue fever, which is a life-threatening emergency, can develop quickly. The warning signs usually begin the first day or two after your fever goes away, and may include severe stomach pain, persistent vomiting, bleeding from your gums or nose, blood in your urine. When to see a doctor: severe dengue fever is a life-threatening medical emergency. Seek immediate medical attention if you've reached risk factors. You have a greater risk of developing dengue fever or a more severe form of the disease if you live or travel in tropical areas. Being in tropical and subtropical areas increases your risk of exposure to the virus that causes dengue fever. Especially high-risk areas include Southeast Asia, the Western Pacific Islands, Latin America, and Africa. You have had dengue fever in the past. Previous infection with a dengue fever virus increases your risk of severe symptoms if you get dengue fever again. Seen in areas of the world where dengue fever is common. One dengue fever vaccine, Dengivaxia, is approved for people ages 9 to 45 who have already had dengue fever at least once. The vaccine is given in 3 doses over the course of 12 months. The vaccine is approved only for people who have a documented history of dengue fever or who have had a blood test that shows previous infection with one of the dengue viruses, called seropositivity. In people who have not had dengue fever in the past, seronegative, receiving the vaccine appears to. Dengivaxia is not available for travelers or for people who live in the continental United States. But in 2019, the U.S. Food and Drug Administration approved the vaccine for people ages 9 to 16 who have had dengue fever in the past and who live in the U.S. territories of American Samoa, Guam, Puerto Rico, and the U.S. Virgin Islands, where dengue fever. Prevent mosquito bites. The World Health Organization stresses that the vaccine is not an effective tool on its own to reduce dengue fever in areas where the illness is common. Preventing mosquito bites and controlling the mosquito population are still the main methods for preventing the spread of dengue fever. If you live in or travel to an area where dengue fever is common, these tips may help reduce your risk of mosquito bites. Stay in air-conditioned or well-screened housing. The mosquitoes that carry the dengue viruses are most active from dawn to dusk, but they can also bite at night. Wear protective clothing. When you go into mosquito-infested areas, wear a long-sleeved shirt, long pants, socks, and shoes. Use mosquito repellent. Permethrin can be applied to your clothing, shoes, camping gear, and bed netting. You can also buy clothing made with permethrin already in it. For your skin, use a repellent containing at least a 10% concentration of DEET.